after the meeting today so that you all may share it with your teams and anyone else on your staff who may want to view it. Hang on just a moment. All right. So I wanted to say hi to everyone and let you see my face for a minute, but I'm going to turn my camera off for now and just share our presentation. So thank you everyone for joining our second new provider onboarding session for our community supports providers. So our agenda today, we're going to go over our new CalAIM webpage on the HPSM website and some of the information and resources that are there. And today we're going to focus on the prior authorization process. So we'll talk about what prior authorization is, the prior authorization form, and the community supports request information form, medically appropriate criteria, notification letters, and then member eligibility. And just wanted to reiterate for anyone who just joined, if you have questions you think of throughout the presentation, feel free to write them in the chat tool or just record them for later. You will have a Q&A section at the end of our slides. But everyone is muted for now while we share our slides. And we also just wanted to recognize there's going to be a lot of information we're sharing today. We're all working together on this new implementation. So just wanted to reiterate, we'll continue to have training opportunities. We'll continue to be available to help answer questions and make sure everyone's supported during this transition. It can be overwhelming to receive all this information, but just wanted to reassure you that we will all learn together. Okay, it looks like someone's having trouble with their audio. Let me see. Okay, I tried unmuting everybody. Okay, I do see that some folks are able to hear me, so that's great. If anyone cannot, oh, I'll put this into the chat since I guess if you couldn't hear me, you couldn't hear me explaining this. If anyone cannot, okay, good. Looks like Brianna maybe is able to now hear, but if anyone cannot hear audio successfully, suggest leaving and rejoining the meeting to see if that helps. Okay, hopefully we are all set there. All right. Okay, so first thing we wanted to share with everybody is some updates to our HPSM website. So there is a CalAIM page now on our website. The link to that is here. We will share these slides after the meeting today. So we encourage you all to visit this portion of our website and review the content there, and continually check back there for updates as well. This is where any relevant updates will be published for our CalAIM providers. And to make a request for community supports services, there are 2 documents required, and the links to those are both on this section of the site. And those are the HPSM prior authorization request form and the community supports request information form.
Hey, Molly, this is
Yes.
Gail. I'm not sure what everyone's seeing on their end, but I think your slides are gone.
Oh, okay,
Do you want
thank
to
you.
reshare your screen? Okay, thanks.
Yes, sorry about that.
Thank you.
Technical difficulties. Can you see it now?
Yep.
Okay, great. Thank you, Gail. Okay, let me go back one slide because I think I may not have been showing this slide when I was speaking. Yes, so this is the link here to our CalAIM portion of our HPSM website. So this is where we recommend you all review the resources that we have available. And this is where we have links to the 2 documents that are required to make a request for community supports, which are the HPSM prior authorization request form and the community supports request information form. All right, so wanted to give a brief overview of the prior authorization process from beginning to end. And this process might look a bit overwhelming, but this will be available to reference. And, once again, we'll all be here to work through this process and answer any questions together. So the first step here is that a referring party, which may be a variety of different types of providers, would review information on HPSM's CalAIM website to learn about the community support services that are covered by HPSM. And then from there, if they determine that a member was eligible, potentially eligible for community support services, and the member was interested in receiving those, that provider or HPSM's integrated care management team would submit a prior authorization request. The other way that a prior authorization request may be submitted is by you all as a community supports provider for those members who are already receiving community support services. When their authorization end date approaches for their current authorized period, and the member still needs community support services, that would be the time when you would submit a new prior authorization request to HPSM. And just want to highlight, as noted above, all requests should occur in coordination with the interested members and their care manager. So once HPSM receives the prior authorization request form, as well as the community supports request information form, then HPSM's utilization management team will review that request and make a determination about whether the member is authorized to receive services. Routine prior authorization requests will be decisioned within 5 days. Urgent will be decisioned within 3 days. And retro authorization requests will be reviewed within 30 days. After a decision is reached, a decision letter will be faxed to the member, the community supports provider, and the others listed on the prior authorization form. And the community supports request information form will be sent to the servicing provider. Once that is completed, the community supports provider should confirm member eligibility and the authorization start date, and then outreach to the member to begin providing services. Okay. So what is prior authorization? All community support services that you provide to members require prior authorization before providing the service. And this is a process through which HPSM verifies that a community support service is medically appropriate before you are authorized to provide the service. Another provider or care manager may submit a prior authorization request in coordination with the member listing your agency as the servicing provider. You may receive an authorization notification letter and receipt of PA request for a member that you did not directly request services for. And the member, the community supports provider, which is also referred to as the servicing provider, and additional provider, if noted on the PA form, will receive a notice of authorization. So an authorization, approval, or denial letter. Okay. We wanted to go over our prior authorization request form. So you can find this form linked again on the CalAIM portion of our website. And a couple of tips to make sure you complete this form correctly. It must be faxed. When you fax it in, you do not need to use a cover sheet. And please fax the prior authorization form as the first page with the community supports request information form and any other supporting documents after that. Make sure you're using the current version of the form, which is posted on our website. And make sure that you are typing in the form. It is a fillable PDF. Handwritten requests will most likely be sent back by our system. And when you submit the prior authorization form, you also want to include medical necessity documents, or in this case, medical appropriateness documents that will demonstrate why the service is medically appropriate. So that could be the treatment plan, clinicals, or notes. You want to make sure that the information on the form is accurate, including the correct diagnosis and CPT codes, correct dates of service, and member and provider information. And please use one form for one patient or member. We cannot process multiple members' information per form. And please only fax one form at a time. And then on the top of the request here, there will be a checkbox for either routine or urgent requests. The definition of an urgent request is one in which the requested service is medically needed within 3 business days, and those will be expedited. But the majority of requests should be marked as routine. And so please make sure to use that categorization sparingly for when services are truly urgent. And then the requested service dates will be within a 12-month span for the start and end date. And those can vary based on the community support service type. Okay. So now to go over the community supports codes for authorization. HPSM has a unique CPT code for each community supports service option. And so on the CalAIM website is also a link to this provider list and authorization tips document. And so please be sure to reference that document, which will be linked here when we send out these slides, for the community support service CPT code and the required provider information, such as NPI number, fax, and phone number to complete the prior authorization request form. Additional codes will be needed for the claims process. And for the claims process and any additional billing questions, please continue to work with HPSM for continued individual guidance. Okay, so now I wanted to go over the prior authorization units of service and dates of service guidance a little bit. So for each community support service type, you'll want to make sure that you're using the correct code and also specific number of units. So when you complete the prior authorization form, here at the bottom of this slide, you can see the portion of the form that this would apply to. You will need to include the code, um, the types of service requested, and then a number of units of service. And so recommend referencing this slide and any additional resources as you begin to fill out those forms. So I'll just read through this unit guidance a little bit. For housing navigation and transition services, you would want to enter up to 6 units. For housing deposits, that would just be up to 1 unit. For housing tenancy, that would be up to 12. For environmental accessibility adaptations, that would be up to 1. For nursing facility transitions or diversion to assisted living facilities, that would be up to 12 units. And if with a transition to an RCFE or ARF, that would be up to 365 units, which would translate into 365 days. And community transitions and nursing facility to home would be up to 12 units. And medically tailored meals would be up to 168, which would be up to 168 meals. And so for the dates of service section, you want to make sure that those dates would be within a 12-month span. Okay, so in addition to the prior authorization form for every request, you will want to submit this community supports request information form. This is required to help determine medically appropriate criteria for the service that is being requested. And the servicing provider, the community supports provider, will receive a copy of this form for approved members. And this will be sent separately from the NOA approval letter. And so here on this slide, you can see a little bit of what this form looks like as well. And it's also viewable on that CalAIM webpage. Corrections. So if you complete the prior authorization form with an error, you may be asked to submit a correction form before a decision can be made on the authorization. The correction form is linked here on our website. And if you submit a request for a service provider that is at capacity or not available for the service requested, that may require that a correction be submitted to change the dates of service or change the provider. Okay. Medically appropriate criteria. So when you make a request for prior authorization, you must complete and attach that community supports request information form. And you will need to provide information to show that this member meets the criteria for the service being requested. So for diagnosis codes, those may be a mental health or substance use diagnosis, a chronic condition diagnosis, or codes for housing or other social issues. And please include attachments that describe the member's status relative to the service that is being requested. So criteria examples may include an individualized care plan, case notes noting complex social factors, or an eviction notice. And here is a link to additional eligibility criteria from the state DHCS, Department of Healthcare Services. All right, so the next slide is notification letters. So after you submit a prior authorization request for either a continuing member or a new member who will be receiving, who may be receiving community support services, you will receive an authorization approval or denial letter from HPSM by fax. When you receive an approval letter, please make sure that you note the start and end date. This is the service window for when services can be rendered and claims can be paid. To request continued authorization of the community support services, the CS provider will need to complete a prior authorization form in coordination with the member. And just a note on timing, when you submit a new authorization request, you want to make sure that it's at least that the dates of service on the authorization request are at least 1 day after the end date of the existing authorization. Otherwise, they may be identified as an overlap, which may cause a delay. Okay, so once you receive a authorization approval letter for a member, you will want to check member eligibility. So checking eligibility verifies that the patient or member is still actively covered by HPSM at the time of your service. And this is important because if the patient or member is not covered on the date of service, HPSM cannot reimburse the provider. For Medi-Cal, eligibility is determined at a state level, and so this is important for providers to check prior to every visit or service. And a prior authorization approval letter is not a confirmation of ongoing eligibility. So even once a provider receives that authorization approval, it's important to still check member eligibility on a regular basis. How to do so? Providers can check member eligibility online on our provider portal. So they may log in here and create a username. We have a video available on our website for how to check that eligibility. And if for any reason the online tool is not accessible or available to you, providers can also check by phone. So there are several ways to verify eligibility. Okay, and finally, just a reminder of some important links for this process. So one is this link to our CalAIM webpage on our HPSM website. This includes the ECM and CS provider list and authorization tips, as well as the community supports request information form that needs to be submitted with every prior authorization request for community supports. And then we also have our prior authorization page, which includes the prior authorization request form and referral authorization correction form. And then here's a link to our provider portal where you can sign up to check eligibility. And finally, here we have a link to our provider manual, which is our online resource that contains information on all of the HPSM processes that our providers may need to follow. So it's just a good resource if you ever have any general questions. That's a great place to start. All right, so this is a good slide to reference, again, going forward after we send out these slides, in terms of where to direct any future questions you have for HPSM. So if you have questions about how to submit a claim, why a claim denied, or corrections that you need to make to a claim, you can contact our claims department directly at the information here. For questions about prior authorization status, you can contact our utilization management department by phone at this phone number here. For questions about your credentialing, your contract, or rates, so this would be when you're still in the process of joining HPSM's network, and going forward, any additional questions you may have about your rates or contract, you can send those by email to our provider services department. And then finally, for any programmatic questions or escalated issue resolution, any issues you're having a hard time getting solved elsewhere, you can contact our strategic partnerships group at this email address here. Okay. Oh, I don't think we need to show that one. All right, so with that, I'm going to leave some time for questions. Let me see if I can unmute folks. All right. Okay, so hopefully you all are unmuted. I don't know if anybody wants to give that a try, but you can also just enter your questions again into the chat tool if you prefer. And I do see we have one here, which is what are CPT codes? So let me see if I can describe this effectively. CPT codes are the codes that providers use to demonstrate the service that they're providing in order to receive authorization and receive payment. So a CPT code typically does need to be submitted with a claim as well as with an authorization request. And I'm sure there's much more that can be said about codes, but that's kind of the basic description of how they're used. And if anyone else from HPSM would like to add to that, please feel free.
You got it correct, Molly. Sorry, I hear an echo, so sorry about that. But yes, that is what a CPT code is, and we want to make sure that when the CPT code is submitted, that we, as well as the dollar amount, is what I was going to add. But I think you added that already. Thank you.
Yes. Thanks, Clarissa. Okay, well, I see we have some hands raised. Let's start with Robin.
Hi there. So I'm the OT with IOA. My question was, when you're doing like the housing one, back to that slide that you said up to 12 units or whatever, like would it always basically just be 12 units because you're trying to do for a full year, or is there a reason why you would do like six units for 6 months?
Yeah, that's a good question.
Molly, this is Danny. I can take that.
Okay, sure.
Yeah, Robin. So if there are any situations where it would be less than a year, then you would put the more appropriate number of units. For some of these units, it really depends on what the code and the service is. And I'm happy to somebody in claims and myself, a key contact in claims and myself, we can, if there's any codes and specific questions around that, happy to take that and discuss with you the specifics of each one.
Okay, got it. Thanks. But basically, like, it's not for like like say it was like November, you wouldn't say for 2 months, and then you start the next year. You're doing the full year if you're thinking the person's going to live somewhere for the full year.
I would think that would make sense for a
Okay.
housing
Got it.
code, yes. But if
Okay.
again, if you need to talk any of them out, we can
Okay.
definitely
No, just
troubleshoot.
kind of getting the general gist of it. Thank you.
Great, thank you, Dayani. Okay, I see a question here. Where do we find the codes? And Diane, I think you might have kind of addressed that as well. Is that something that would potentially be followed up on?
Yeah, I'm happy to take this one.
Yeah.
Yeah, happy to take this one too. So, all of the codes, all the CPT codes that each provider is contracted for will be found first and foremost in the contract. And then secondly, at least for each of the providers I'm working with, we've created a kind of a cheat sheet of CPT codes and services and associated billing guidance that I'm happy to share. And also that'll be kind of case by case basis with each of my providers. And if we need to do kind of a more formal training on billing, happy to do that as well. But yes, we'll provide a codes cheat sheet, and that it's also found in the contract.
Thanks, Danny. This is Gail. Just kind of wanted to also add that our CalAIM webpage does have the ECM NCS authorization tips. And there is that grid with the providers listed, as well as the CPT codes. So you can easily reference that as well.
Great, thank you, Gail. I see a hand up from Travis.
Yeah, thank you. First, thank you very much for presenting this information. I had a question about the fax. So we can definitely do, do the process with faxing. It's sort of out of the ordinary for us. So I was wondering, is there any expectation that sometime in the future we'll be able to do the prior authorization process in a electronic way rather than a fax? And also a question about the fax. You mentioned that we wouldn't need to use a cover sheet. Would it be the preference of HPSM that we don't use a cover sheet, or like if we use the cover sheet, it's fine?
I can address at least the cover sheet piece, and Clarissa, correct me if I'm wrong. I believe HPSM requests that providers do not use a cover sheet.
That is correct, yes.
Yes, so currently fax is the only method by which we're able to accept prior authorization requests. I do think there's a hope to eventually make that something providers can do online, but I'm not sure if we can speak to the time frame that will be achieved in.
Thank you.
All right. Any other questions that folks have for right now? I know we did share a lot of information, so feel free to review and digest all this information. We will send out the video, the recording again, if you'd like to rewatch it or share it with others. And then, let us know if any additional questions arise.
Sounds good. Thanks, guys.
Thank you.
Thanks, Molly.
Thank you.
All
Thank
right.
you.
Have a good
Give
one.
everyone
Thanks.
back some time. Thank you, Gail and Dayani as well, and everyone from HPSM. All right, I think we'll wrap up. Thank you, everyone, for your time today.
Thanks again.
Thank you.